good afternoon, and good evening, and welcome everyone to today's Global Café. My name is Katrina Buzanis. I'm a Director of Policy, Advocacy, and Innovation at the IFA. And today I'm really pleased to introduce our topic and speaker. So today we will be talking about the social and behavioral interventions to improve vaccination uptake among older adults. So vaccination is a cornerstone of public health, saving millions of lives each year. However, achieving optimal immunization coverage remains a global challenge, and understanding the behavioral and social factors influencing immunization is crucial for tackling this challenge. So individual beliefs, knowledge, and perceptions, as well as trust in healthcare systems and the convenience of vaccination all play significant roles. And today we will be exploring how some of these factors can help to develop more effective interventions, can address vaccine hesitancy and improve immunization rates, in addition to discussing tools for community partners to act as champions of vaccination. So joining us today is Mr. Jun Ryan Orbina, a technical officer in the Demand and Behavioural Sciences at the Department of Immunization at the World Health Organization. So Jun has over 8 years of experience in improving vaccination demand and uptake, and his current assignment at the World Health Organization headquarters focuses on community engagement for immunization, vaccine safety communication, vaccine literacy, and resilience. And previously, from 2015 to 2021, Jun was the vaccine communications focal point at WHO Philippines, where he supported routine immunization, vaccine introductions, and vaccination campaigns, response to vaccine safety events, and the polio outbreak and COVID-19 pandemic responses. So his experience spans strategic and risk communications, epidemic management, and community engagement, leveraging evidence-informed strategies and interventions to improve vaccination trust, confidence, and uptake. So welcome to the Global Cafe, Jun, and thank you so much for being with us.
Thanks very much, Katrina, and hello to everyone. Good morning, good afternoon, and maybe good evening to some of you.
Mm-hmm. So Jun, we always kind of like to learn a little bit about you to open up the Global Cafe. So I'm wondering if you can tell us a bit about yourself, your story, what led you to being interested in vaccination, and now the work that you're currently doing at WHO.
Very interesting way to start this session. Thanks, Katrina. Well, I would say that growing up, I've always had this mix of various interests in fields that don't seem to come together. Like I was interested in the biomedical sciences and the behavioral science side of things, in the more creative pursuits, also in public health. So I would say that my current role at the WHO headquarters for vaccine demand and behavioral sciences is really a sweet spot for me, where I can put in all my background, my passion, my interest as well. I have a background in science communication and in public health. I used to work at an infectious disease lab before moving on to become communications officer for vaccine preventable diseases and immunization at WHO Philippines. And it was initially just a 1-year engagement, but it turned out to be quite a longer one. And it was really an experience that I really appreciate, knowing the stories of people in the field, of mothers, of older persons, of different contexts, of different cultures, and how these contribute to one's beliefs, one's behaviors towards vaccination. So it's really a fascinating field for me. And from WHO Philippines, I moved to WHO Vietnam, and then I took on this assignment at the headquarters, wherein I'm part of a 3-person team, a very lean team for demand and behavioral sciences for the essential program on immunization, which is under the Department of Immunization, Vaccines, and Biologicals. So part of my work has been explained by Katrina, and it's at this space where we do a lot of developing normative guidance and resources, particularly in this increasingly recognized field of looking at demand and behavioral sciences to improve uptake for vaccination.
Mm-hmm. Yeah, thanks, Jude. I think it's a really interesting niche, this kind of science communications, and because we so rarely talk about science in a way that is kind of through people's stories or through, a way that's more approachable. So I'm looking forward to kind of diving into that a little bit more with you as we talk about some of the work that you're doing.
Mhm.
So to kind of set the scene a little bit, I'm wondering if you can talk about, what the state of vaccination is globally and some of the things that you and your team are working on to promote vaccination. I know, right now there's a lot of talk about something that's called the big catch up, and improving, vaccination uptake across the life course. So can you touch on a couple of those things and set the scene for us a little bit?
Probably I'll yeah, quite a few questions to answer there, but maybe I'll point out three important points. First is looking at the success of vaccination so far and the challenges that we have. And third, where life course immunization comes in. So this year, we're actually celebrating the 50th year anniversary of the essential program on immunization. Used to be the expanded program on immunization. It's just a celebration for the entire community, knowing that vaccines are really one of humanity's greatest achievements. Some of you may have seen the paper that was published that vaccines have saved an estimated 154 million lives in the past 50 years, and that's around 6 lives per minute, actually. And when we look at childhood survival, around 40% of this is actually attributable to vaccination. So currently we have expanded the expanded program on immunization towards essential program on immunization, and it now includes universal recommendations for childhood vaccination, as well as context-specific recommendations for several other diseases, which extends immunization from children towards adults, towards the older adult population. But we know as well that vaccines still are not reaching everyone everywhere. And I know that most of the conversation really on this is currently on childhood immunization, but we'll deal with, older adult vaccination in a while. We've seen the backsliding of immunization coverages due to COVID-19, but just to point out that there have been persistent issues, health system issues mostly, which have contributed to a decrease in vaccination uptake even before the pandemic. So quite a number of children have missed out on immunizations. If we look at the pandemic years from 2020 to 2022, 67 million children have actually missed out on vaccination, and more than half of these are what we call zero-dose children, those who have not received any vaccines at all. That's why we have the big catch-up, as you mentioned, Katrina, which is a three-pronged strategy looking at catching up those children who have missed their vaccines. That's the catch-up part. Then we have the restore part, which is to reach those who have not been vaccinated at all. And in doing so, we have the strengthen aspect, which is to improve immunization systems, take advantage of the catch-up activities to improve the immunization systems as we move towards the IA 2030 or Immunization Agenda 2030 goals. So we'll see more of the results so far of the big catch-up, which was launched last year when the estimates will be published around July this year. But just last week, we've had the World Health Assembly, and we've seen quite a number of countries really putting forth their efforts towards strengthening the big catch-up, and it spans lower middle-income countries and high-income countries as well. But when we talk about IA 2030, we reach the third point, which is we need to better reach individuals from childhood towards the elderly, because IA 2030, its vision actually says a world where everyone, everywhere, at every age, fully benefits from vaccines for health and well-being. That means that we have to provide equal opportunities for everyone to live longer and healthier quality lives, and that is regardless of gender, of age, whatever social group. And we have seen in COVID-19 vaccination that adult vaccination, especially older adult vaccination, is actually possible within the right political engagement, funding, capacity, And we've seen a tremendous amount of doses rolled out during the pandemic years. And we know, I think the community knows very well the importance of vaccinating the older adult population in looking at how just ensuring protection of the older adults, especially that there are new diseases coming out, or new diseases, or diseases which have been eliminated, which are now resurging at the same time. The multiple layered effects, of course, of other health conditions like non-communicable diseases, of immunosenescence, and a lot of these, and the growing older adult population, all of these would really point towards the need to strengthen life course immunization, including the vaccination of older adults. But that is really a lot easier said than done. There are major efforts needed for life course vaccination, for older adult vaccination, including policy changes, resourcing, training of healthcare workers, looking at service delivery points, how to improve demand and uptake, which I think will look further into our conversation today. So this is quite a rich topic, which needs to be really unpacked. And I'm very glad that IFA is really very active in this space, as this is an area of priority and concern as well for WHO.
Mm-hmm. Yeah, thanks so much, Jun, for providing that overview. And as you mentioned, there are a lot of points to tackle. So I want to kind of zero in on your real expertise, which is, what we call the behavioral and social drivers of vaccination.
Mm-hmm.
So can you tell us what the behavioral and social drivers of vaccination are? What is this kind of framework that you've developed?
Yeah, so classically, when we think of vaccination, it's just a supply and demand issue. As long as we have the program to deliver it, and as long as we have the vaccines, the assumption is that people will demand for the vaccine and get vaccinated. But we know that that is not the case. That is an oversimplification. And that's why we have the behavioral and social drivers that we need to study in order to increase vaccination uptake. And when we speak of the behavioral and social drivers for vaccination, these are beliefs and experiences on vaccination that can affect uptake. So maybe a good way of understanding this is thinking of a scenario, probably. Say, for example, we have a 65-year-old woman named, I don't know, maybe Eve, let's say. Let's say Eve lives in a village, but she lives alone. But she knows of the increasing cases of influenza, say, in her area. So she has that certain level of risk perception. She also cares about her grandchildren, and she cares about her own health, not that she's protected from influenza, but a greater amount of care is how she feels about not being able to transmit this or any other disease to her grandchildren whom she visits regularly, let's say weekly. And let's say she goes to a weekly gathering in her maybe community center and plays some community game, maybe bridge in there. And one time she got into a conversation with one of her peers, and one got vaccinated, who got vaccinated and experienced some side effects, for example, which Eve felt that she didn't want to experience those. So that now begins those are now stimuli towards decision making from Eve's part. And then Eve, for example, receives a call from a health worker who's also a friend. And that friend said that flu vaccines are now available at the health center, actually. You can just go there and have yourself vaccinated. So she wanted to go there to ask further questions, but when she arrived, she had to wait for an hour before getting entertained, and then when she decided to get vaccinated, the supplies are not available, for example. So she had a negative user experience in that. So she decided not to get vaccinated. So just in this simple example, you can see the various factors which affect one's decision making in getting vaccinated. There are personal reasons, There are reasons within the community. There are reasons also within the health system, or even much broader reasons. And it's important for us to understand these different reasons. And I think more important, and I've learned this in the IFA conference that IFA invited me to be part of a year ago, that there was really emphasis that older adults are not a homogeneous population. Many would have comorbidities, for example, and would require assistance, while some will be able to navigate their own needs easily. So some may be socially connected, some may be independent. So it's really not a one size fits all for everything. So for everyone. So that really puts into fore the importance of understanding the behavioral and social drivers for immunization. So to help out countries, programs, and partners understand this, WHO convened experts for vaccination, for social and behavioral sciences, to develop a framework and measurement tools to understand what drivers can be modified. And these could be grouped in 4 different domains. People's beliefs, which are thoughts and emotions towards vaccines; social influences; one's motivation, which includes one's willingness or intention to get vaccinated; and the practicalities around it. So there are different measures in these 4 different domains, and there are now available tools for routine vaccination and COVID-19 vaccination for both quantitative measurement of these different domains and also for qualitative measurement in terms of interview guides for all these. Upcoming as well are BSD, that's how we call this framework, the best tools as well for influenza, which will be available or published in a couple of months, but I'll share my email later on in case you would want an advanced copy of this. I think this can be shared as well. So all these talk about measurement, but we know that it's not enough just to measure. It's what really would matter would be the interventions themselves. So once we measure and provide evidence on what would drive uptake within a particular community, then you're able to decide on the right interventions, which will bring about increased uptake. And at the same time, that would also help us guide in terms of resourcing and in terms of other activities and other partners to engage as well. So it's really about using evidence to allow us to improve uptake of immunization, looking at the behavioral and social drivers as one of the important inputs into this.
Mm-hmm. Yeah, thanks, Jun. That was a really kind of comprehensive overview. So thank you for walking us through kind of all of the different steps. I'm wondering, to take a closer look at older people specifically, is there any, research or evidence that you've encountered on the specific drivers of vaccination for older people and interventions that seem to be particularly successful in vaccination of older people?
Yeah, so now there's ongoing systematic review by my colleagues within our unit looking at COVID-19 vaccination, and part of that is looking at demand for COVID-19 vaccination and looking at published studies, which provide insights on these different interventions for older adults. So this is still in process, but what we're seeing as of the moment is that there are fewer published peer-reviewed literature and interventions specifically for older adult vaccination uptake. But we know, I think the community knows as well, that there are quite a number of good case studies and documented experiences in gray literature. But what we so far see as a pattern is that, and this is similar to the broader pattern that we see for behavioral and social drivers for immunization and even for other health services, is that first, multi-component interventions are needed to drive towards impact in terms of vaccination that would be increased uptake. So it's not just one intervention alone, but a combination of different interventions. And when we speak of interventions which are most effective, these are interventions which are geared towards driving or shaping the social and structural environment. These are stronger. That means interventions wherein we bring vaccination closer to the vaccinees, improving access, improving convenience, for example, improving the health worker experience. In terms of the social environment, these are recommendations from health workers, for example. improving the service experience of those who are about to get vaccinated. And this is compared to the weaker effects of the interventions which target to change knowledge, attitudes, and beliefs. Because we know that once knowledge is ingrained, it's really hard to change them. But that's not to say that that there's no value in still doing education, knowledge-based interventions. This is still very, very important. But what the results just so far point to us is that these need to be coupled with access-related and social structure-related interventions. So these need to come hand in hand for them to be very effective. WHO published, I think last year, a guidance on vaccinating older adults for COVID-19, and we can get some insights on what have been done in several countries. In Ghana, for example, there was the engagement of older adult networks, and for them to be able to identify in the communities, for example, and how to access the older adults within the community. So it's using these organizations to register the clients for vaccination and using them as channels as well to provide information. In Mauritius, the community health workers were involved in reaching out to registering older adults for vaccination and to pointing them at the nearest areas or near sites where you can get vaccinated, for example. There are also systems, for example, for reminder and recall when the next dose is due, and reminding the vaccinees to come back for their next dose. There are some examples as well on integrating vaccination with other programs, for example, just widening that net wherein you'd be able to vaccinate the older adults at different points along their contacts at the health system, whether they're consulting for non-communicable diseases, for example, or for some other concerns, for physiotherapy, for example, and using these as touch points such that they can be vaccinated as well for older adult vaccines. So there are quite a number of these interventions, but hopefully we can see a bit more insights once we have that entire learning agenda set up and hopefully published.
Mm-hmm. Yeah, I think just in follow up to some of the things that you're mentioning, Jun, I think my kind of number one question is how do we actually implement some of these things? So I'm wondering if you have any advice from, the research that's been done, or even from the things that you've seen of how do we actually translate some of the good case studies and some of the interventions that seem to work, across the board into different, whether it's different health systems or different, cultural contexts or things like that.
I think it always starts with diagnosing. It's understanding your situation. So it's using the different tools that we have available to understand the context better, because we know that we have different kinds of interventions, but one size doesn't fit all. There's a wide variety and heterogeneity as well of different communities. So it's really important to understand communities. So how do we do the understanding part? It's through the tools that we have shared earlier, or there may be other tools as well, which you may use, say, exit interviews or very short surveys, which could guide your planning on what would improve vaccination uptake. What's important as well as in terms of planning, it needs to be participatory in its approach. That means if you're part of the program, you need to invite the people who are within that community or better informed to inform your interventions in terms of, say, timing of vaccination, or where to put up vaccination sites, or what would improve convenience, or what are the areas where in service experience, for example, needs to be improved on. That's where we target our training. So having that space as well for members of the community representatives to be part of planning and to inform them and to have their insights inform planning, that would be important as well. And that's important also in the trust building process, knowing that because part of your community designed the services, then that speaks of the empathy that they have for your own community as well. So once these interventions are selected and implemented, it's also important to monitor them and evaluate them using as well the different tools that you've mentioned earlier to see if the different interventions are working or not. So it's a really an iterative process of which is we would say evidence-driven in the most ideal sense, and at the same time community-driven as well in a very highly participatory approach if however that is going to be rolled out and possible in different contexts.
Yeah. I just want, so I have a couple questions to kind of follow up on some of the points that you've just mentioned. But firstly, I want to just ask a few of the questions that have come up in the chat box. So we do have a question from Shmuel, who is a weekly contributor at our Global Cafe and often asks questions. So we're very appreciative for Shmuel to be asking a question every week and joining our Global Cafes. So he is asking, how is WHO trying to support practice improvement to advance vaccination uptake among older adults in more low socioeconomic groups of the population?
Can you kindly repeat the question?
Yes. So how is the World Health Organization supporting improving vaccination uptake in older adults in low socioeconomic groups?
Okay, so first from our end at the Demand and Behavioral Sciences team in WHO in the Department of Immunization, Vaccines, and Biologicals, as mentioned, we have these tools available which are useful for both. These are really practical tools which are useful for both lower and middle income country settings as well as in the high income country settings. And these are really, these tools come with a practical guide as well to ensure that even in lower income settings, programs and partners will be able to identify and plan properly using evidence-guided interventions in increasing uptake for the older adult population. So we have these guidance documents which are published. We also have published specific documents, for example, for improving uptake of COVID-19 vaccination among older adults. Maybe I can share the link later, and that provides some insights for program planners and partners also on how that can be done, as well as examples from various settings, including lower and middle income country settings, on how that came into fruition. Also, some guidance documents, for example, in integration of vaccination and how it looks like. And on a systems level, that would be helpful normative guidance as well in these different settings. At the more granular level, at the country, regional and the country level, then I'm not very aware of very specific. Likely there are a lot of activities specific on this, but I don't have an eagle's eye view yet of what different countries are doing. But from our end, for example, in my experience at WHO Philippines, for example, at the country level before I moved to a different country and then to headquarters, WHO was particularly helpful there in giving a voice to the older adult population, for example, in helping out with advocacy for a national senior citizens group, supporting that group to be able to advocate for vaccination during COVID-19. And there are other support as well at the more local level in terms of strategies and in terms of health worker training. So there are a variety of support which the organization provides both at the headquarters level, which is more of normative and guidance provision, and also at the regional and the country levels, which are more on the implementation side.
Yeah, thanks, Jun. And that kind of brings me to, my next question, which is really around, some of the work that your group has done to advance, community partners as advocates for vaccination, champions for vaccination in their communities. And you've kind of touched on it throughout, but I'm wondering if you can speak specifically to the importance of having the engagement of, different groups in the community and what kind of, support you provide or recommend when they're talking to people in their lives about vaccination.
Yes, I think this is a I would say, a hot topic now, looking at how communities can be better involved in not just in service planning, but in the entire health system as well. Because if we look very broadly at global indicators for trust, for example, we can see that at least for the past 2 years, there has been low trust in governments and a higher level of trust when we refer to people who are our peers or who are scientists. I'm speaking from data which are published from the Edelman Trust Barometer. You can look it up, and you can see there, for example, that CSOs actually and community-based organizations and people from your communities globally, people would trust them a bit more than, not a bit more, a lot more actually than government leaders, for example. So there are those quite surprising or maybe a bit expected results as well. So while these are global indicators, and this would probably be different from one country to another, but as a pattern, what we could see here that in terms of delivering health services, there's really a need to somehow bring back the decision-making and empowerment as well to the communities. That's why organizations such as the IFA and the other organizations who are members of this network are really important in terms of having a voice in terms of planning for immunization, advocating for immunization, and also in evaluating immunization activities. So when you speak of community representatives, they would have different roles at the community level. We can have community representatives who can help out in amplifying correct information, for example, for example, being equipped in meaningful conversations with peers, for example, because we can see that for older adults, they listen to their communities quite better. Connecting also the vaccinees to the services, providing information on where to get the services, what's the timing, what vaccines are available, and raising other representatives as well, such that they're involved not just in sharing of information, but really having that space in planning of immunization programs, in implementing immunization programs, and as well as evaluating immunization programs. So it's a space which is defined as well in the Immunization Agenda 2030. One of the principles of the agenda is that we need to have people-centered immunization programs. That means having more space for communities to be able to participate in the immunization program itself. And through such participation, which is aided by NGOs, CSOs, and professional groups, we'll be able to increase the transparency and accountability also of immunization programs, increase the ownership of immunization programs such that it's not just a health sector effort, but really a community goal that everyone would have access to vaccination and have the best quality of life that they would have regardless of age or gender or social status. And that in turn, by having this involvement, we're able to build on trust, and that gives us resilience as well to different pressures and threats that could all of a sudden bring about trust in immunization or even in other health services. So that's why we would say that community organizations, CSOs, and professional groups really have a very important and a growing role in this space.
Mm-hmm. Yeah, thank you so much for your response. So I do see Indu, and I see that you also have your hand up and also your questions in the chat. So do you want to unmute and pose your question to June?
My question is that we can work hard to get the community support and everything, but bottom line comes to funding, because the mainstream funding is for mainstream way of doing things. And when you want to do out-of-box process to gain the trust of a community and have community involved and circle around so that you can vaccinate, they can uptake the vaccination you're offered, the funding becomes the gap where you cannot do that. because all funding for vaccination goes to the mainstream approach of vaccination. How can we change that?
That's thanks, Indu, for that comment and question. That's really a big question to be answered, and I think it needs a lot of unraveling. But funding for immunization really is about political commitment and resourcing as well. There needs to be buy-in within government leaders to ensure that there's sustained funding for important health services, which will bring about whatever advantages there is to the community or to the country. So it's really making a case for investing, for a country to invest its funds towards funding older adult vaccination and see the economic benefits, say, for example, because that's the language of most politicians, so see the economic benefits of doing so. And I think CSOs would have an important voice in this. But when we speak of disparate CSO organizations, the voice might be little. So it's important really to come together and have a unified voice in this side as well, and really push towards having an investment case for your local leaders, such that it will be able to convince as well that there needs to be resourcing for this particular area. So it's really quite a loaded and difficult to navigate question as well, because for different settings, there are political implications on this. There are resource implications as well. There are competing limited resources and competing interests as well in this. So it's really about making a good case based on best available evidence that you have, and shaping it in a language which will hopefully provide more buy-in to the decision makers to be able to put funds on this. Because without the proper funding, we won't have the right policy instruments to run an immunization program, as well as to fund the other aspects of the health system to run it. Yeah. So it's good that this is something which is recognized, but it's also helpful to find other allies, such that your voice is also amplified in this call.
Thank you, Dr. Orbina. I raised this question so that WHO in recommendation can add to the countries that funding should be for this group of people. That was my motive to raise this question. Thank you.
Very, very well heard. Thanks.
Thank you so much, Indu, for your question. Okay, I'm going to go to another question in the chat. Kara, did you want to unmute and pose your question?
Certainly. So firstly, thank you very much. It's been so fascinating to learn more from you today. So I was wondering if there were any interventions that WHO had discussed, or any tools they had developed specific to those with intellectual disabilities. We know that this is an aging population, and also during the pandemic, a population more at risk for poor outcomes following infection due to increased risks of infection in part. So yeah, I was wondering if you could share a little bit more about a small but often overlooked population.
Well, thanks for sharing this, Kara. And for this particular space, looking at tools to engage with those with intellectual disabilities, from our end at the demand team, we have not developed anything on this side yet, but this definitely would be something which is under our radar. We'll raise this within our team. Thanks for raising this as well. And yeah, so for now, there are no tools yet from our end which are specific for immunization, but there may be other cross-cutting tools from other departments within WHO. I have yet to look at them.
Perfect. Thank you very much.
Thanks so much, Kara. I'm going to keep rolling through the chat and go to Catherine. Catherine, do you have a question for June?
Sure. I think we're all assuming that people can be appealed to on a rational basis. So my question is, how do you in WHO think we should deal with the growing vaccination deniers particularly, unfortunately, in my case, one who wants to be president.
Oh, okay. Such a strong but very relevant question as well. And we've seen the increasing volume, I would say, of vaccine deniers, of those who are anti-vaxxers, particularly in the online space. And when we think of what do we need to do with them, I think it really needs careful thinking, because what we don't want to do is to provide them further with a space for them to air out their own, their own stance and their own wrong notions about vaccination, or misinformation and disinformation about vaccination. So it's thinking about interventions which do not provide them or limit the space for them to really engage in this. But on the other side of the coin as well, that also brings us to thinking if we have put out enough correct information out there, and if these information are fashioned in a way which would resonate best with the communities that we serve, knowing that there's not just one way of communicating vaccination messages or vaccine safety messages. Because when there's a dearth of information as well, and also space for uncertainty, and when these are not communicated with the right trusted messengers, then there's space for questioning, and people would resort to other sources of information, such as mis or disinformation being shared with them, for example. There's also the aspect of strengthening our own peers' capacity to be able to distinguish what mis and disinformation is from the correct information, and where to find the correct information. So there are skills needed to be put in place on this as well, and also even just simple skills of not sharing information which may sound like fake news, for example. In these different areas, WHO has guidance documents and has a department here called the Infodemic Management Department, which provides some guidance on how this can be managed at an interpersonal community level, as well as what are the systems considerations, for example, in approaching these different the rising voice of the anti-vaxxers, for example. So at the end of the day, I think it's a question of trust as well, and restoring the trust really to the messengers and the communities, such that we're able to create a positive norm that vaccination is actually good for us, and vaccination is actually important for our own selves and our own communities.
Mm-hmm. Yeah, thanks so much, Jun. It's of course a tough question, but I think something that we're having to develop strategies to deal with. And I think some of the work that you're doing on assessing these different motivations, different behavioral and social drivers, in addition to this issue of trust, I think will go a long way, hopefully, in addressing some of these challenges. So I want to, kind of a similar challenge that we talk about a lot is, a question from Anna Maria around fatigue, not so much such a strong stance, but a kind of equally, I think, important challenge. So Anna Maria, do you want to pose your question?
Well, thank you. Well, thank you very much for the presentation. I had the feeling that, what do you think, that we are facing fatigue toward vaccination post COVID-19? Because I think we are lacking on emphasis on communication and continuing communication about the importance of vaccination. So those who are the deniers that we talk already about here, and also the lack of budget, are to a certain point, I believe, I could be wrong, is influencing this kind of fatigue. And I think as the time passes, more important is to continue emphasizing the relevance of vaccination to keep especially the older people healthy. So what do you think about this fatigue?
Yes, truly, fatigue is something which is existent, which is taking place. We can see, for example, in terms of COVID-19 vaccination alone, and we're not just talking about the older adult population, there's really lesser interest for countries, for example, to roll out and continue vaccinating despite knowing that there's still a high risk for high-risk groups to get the severe disease. So fatigue has come from multifactorial reasons from the pandemic. I mean, it has been quite a long time and being bombarded with the same messages. And for some, probably your own sense of agency has been overridden by vaccine mandates, for example. So it's really a complex issue as well, which needs to be unpacked. But what we can do, at least from the communication side, is really look at ways to repackage the message as well. It may be looking at different touch points in different messengers who can communicate the same messages, or different ways of framing the message, which may be important, or maybe which may be more resonant to what are the current state of motivations that the audience would have. I know it's a lot easier than done. It requires a lot of creativity from the communication side, but as we've mentioned here, we raise also the importance of community engagement. It's not just the messages themselves, but who the messengers are. And what's the social norm on vaccination, for example? Do the people I trust get themselves vaccinated still, despite the ongoing fatigue? Is there social support for me, for example, if my local leader, my local religious leader, or someone I look up to is continues to encourage me to get vaccinated? If my program, for example, immunization programs, continues to provide the easier means for me to access vaccination, then I think all these things would come together and really make that push towards increasing uptake for vaccines, despite, on a personal note, everyone may be fatigued with the information that they've been hearing. So when we look at the different behavioral and social drivers for immunization, we look at other trigger points as well, which we can use and elevate such that we increase uptake for immunization.
Okay, thank you.
Thanks, Jun. I think that's a great answer. And I think, we've seen throughout the pandemic and, historically that, the community partners that we've kind of been talking about, oftentimes really do have a much greater influence, than a vaccinologist or something like that. But I wonder, what is your pitch, or what do you kind of say to community partners to actually get them to engage with this topic when that might not be their expertise, their bread and butter, that might not be what, their kind of focus is. What do you say to encourage them to get involved as partners? And also, what do you have any kind of advice in terms of, from a resource perspective, of people who say, that's important, would love to be involved, but just don't necessarily have the capacity to be involved?
Yeah, so when we speak of involvement with immunization and improving uptake, our involvement can even be just having meaningful conversations with our peers. And it's just a matter of changing the way we talk about vaccination, for example, within our circles. I'm pretty sure everyone has probably a relative, a friend who is against vaccination, or maybe hesitant against vaccination. So there are approaches in doing that, and we can share some resources as well with you. These are evidence-based resources in terms of how it is to communicate with those who may be unsure of vaccinating. In terms of your first question, which is how to engage those who may not be directly involved with immunization to somehow get involved also. It's the same message also, that even with, say, if you're an organization dealing with other issues for healthy aging, but it's the same audience that you're getting in touch with, the same audience who needs to get vaccinated, actually, who you interact with. And it's important to raise if possible, if the opportunities would provide it, the conversations for vaccination. And in that one-on-one interaction, we'd be able to somehow move a person's motivation towards getting vaccinated. And there are several tips on how to practically do that, on having meaningful conversations on vaccination. So for these organizations who may not be directly involved in immunization, I think it may be just a quick lift to also have a small training, for example, in meaningful conversations for immunization, for motivational interviewing, for example, such that in their interactions with the community, they're able to exercise this and hopefully increase one's motivation to get vaccinated. This may be an activity which may be very low resource. It just requires, say, a 1 hour training and then some role play, and then you can have a refresher one maybe after a month or so. And yeah, it's a low-hanging fruit and a quick win, I think, for any organization out there.
Mm-hmm. Yeah, thanks so much for those insights. And we're coming kind of rapidly to the end of the hour, but I want to ask maybe one more question, which is, have you heard from any kind of CSOs or community partners that have taken up some of these tools? Can you talk about their experience with having these conversations with their community members? Any highlights of success or anything like that?
So for now, we are just in the process of socializing these tools, actually, and also training those who will be able to amplify these different tools. So just a couple of weeks ago, we were in this meeting of CSOs in the Eastern Mediterranean region, looking at how they can support the CSOs and the professional groups, how they can support increase in vaccination uptake and also new vaccine introductions. And we engage them with the use of these different tools in raising champions, also in just practical ways of meaningful conversations. And the feedback was that these were very helpful, that tools that they can amplify and adapt in their own specific context as well. So we hope that this might be useful as well to the community that we have here. We hope to have a way of measuring eventually how these would be helpful or impactful in ways that we could improve these tools, and maybe that is something which is coming soon.
Mm-hmm. Yeah. I think would love to hear kind of how organizations are picking this up and running with it and using these tools, because I think we've talked a lot about the importance of trust and the influence that community members can have. And so I think it would be great to see some success stories coming from some of these tools. So that's great. So we are just about at the end of the hour. I'm going to just take a minute or two to introduce our next speaker for next week's Global Cafe. And June, I'll give you a second to just think about some key takeaway messages from our conversation today, and I'll come back to you shortly. So next week on the Global Cafe, we have Ms. Pia Hollenstein, who will be speaking about winning a landmark climate case at the European Court of Human Rights. Ms. Hollenstein is a board member of Lima Seniorin, and will be sharing their success. So that should be a really interesting session next week. So please join us for that. And June, now I will hand it back to you to provide some key takeaway messages from our conversation today.
Well, first of all, thanks to IFA and this community, to everyone who attended here, for organizing this Global Cafe and having this opportunity for us to share the different resources and different trajectory that we have in terms of really mainstreaming the use of behavioral and social science in terms of improving vaccination confidence, demand, and uptake. And I know many here come from different organizations related to aging and are interested with how you can be champions for immunization as well. What I'll just run through as main takeaways sort of in our discussion today are things that a lot of you are more familiar with already, respecting your own experience and your own expertise in the field. And we know that first, context is key, and it's important for us to have evidence in terms of driving the different interventions that we have for immunization. We share with you the different tools that we use such that we're able to have the data needed to guide interventions and the resourcing of these interventions and the implementation and evaluation of these interventions as well. So we hope we move towards being able to use these tools such that they inform the interventions that we do in our communities, particularly for immunization. We've learned as well the importance of multifaceted coordinated interventions with focus on improving convenient access and quality of services, knowing that these are the really strong drivers towards improving uptake. And just an overall message that everyone has a role to play in vaccination, regardless of what level you're working in or working directly at the communities. Everyone has a role to play such that we strive towards creating accountability of our public officials, for example, for vaccination, and really building vaccination as a positive norm for our communities. So we may have varied activities such as advocating to leadership or just speaking to our community members, speaking to peers. All of these contribute towards ensuring that vaccination, older adult vaccination uptake increases in our community, because we know that our goal really is that everyone, everywhere, regardless of age, has access to vaccination, understanding that this has really a strong impact towards improving the quality of life that we have.
Mm-hmm. Thank you so much, Jun. That's a great note to end on. And, I'll add that you have so many resources. So I really do encourage everybody to take a look at all the guides and tools and pieces of work that you've done for immunization programmers, for community partners. There are so many great tools that are people looking to learn more and people looking to be champions of vaccination, as we've talked about. So thank you so much, Jun, for being with us and tackling a lot of tough questions as well. And I'll thank everyone as well for being on the line with the Global Cafe today and engaging and asking some really interesting questions, as well as to our IFA team that helps to put this on every week. And I wish you all a great weekend and hope to see you at our next Global Cafe.
Thanks, and have a great weekend.